Health cloud is an interesting word which I've heard you use on a number of occasions, Dennis, and there are some things which it implies. We kind of know what the cloud is, this sort of distributed storage and plumbing network for the internet, and we kind of all know what health is, but what does it mean when we bring those things together?
You're right, good question, Phil. We live in a world now of cloud computing. One area of our life that cloud hasn't really impacted in the way it has enabled us to do so many transformational things is in healthcare. To date, that's primarily been to do, the restrictions have primarily been to do with security. The concerns are if we put our data into a cloud which is based somewhere, say over in the United States, will our data be secure? And this could be very sensitive data. You know, this could be mental health data, this could be sexual health data. So this is sensitive stuff. But on the other hand, we are not getting the benefits of being able to utilize cloud services. So, for example, patients who want to monitor their own condition, patients with long-term conditions want to perhaps create a diary of their condition. Epilepsy, for example, sufferers may want to keep a diary of episodes that they have, and the number of episodes they have and the nature of those episodes can be an important part of the way they are treated. So there's a need to be able to connect our patients to our healthcare records in a health cloud. Problem we've got though, health cloud has different requirements to what is public cloud. The number of public cloud services like Amazon Web Services, Microsoft Azure, Google and so on. What's happening in health cloud is that there are services that are being developed specifically for healthcare that are being deployed. So healthcare is perhaps less interested in some of the software automation tools that you will find in the public cloud, things like Docker and Jenkins and Chef and so on, those kind of technologies. What health cloud will have are technologies that are important to healthcare. So being able to demonstrate and capture patient consent, for instance. So if a patient wants their data to be shared with researchers who are looking at chronic conditions, to be able to capture that consent, and then for the patient to be able to revoke that consent if they don't feel comfortable with that data being shared. So there's an example. So a consent as a service is the kind of thing. Similarly with identification, if we're going to share healthcare data with the patients, then you need to make sure that the patient is properly authenticated. Are you who you say you are? So tools to be able to do that. So there's a whole series of things that are specific to healthcare. In a technical world, there are also analytics tools which are specific to healthcare. We're involved in a number of really innovative projects at the moment. One, for example, looking at new ways of detecting lung cancer by looking at by doing genetic tests on blood. Gives a very much earlier prediction of the onset of lung cancer. You read this in the press. So the technologies and the analytics tools for healthcare are very specific to this domain. So I think the next generation of cloud, we've seen cloud 1.0 if you like, which is a public cloud aimed at making web access ubiquitous and web development speedy. I think when we go to cloud 2.0, I think we'll increasingly see domain-specific clouds, and healthcare will be one of those domain-specific clouds, I think.
So much happening there. I think it's reassuring to know that there's a lot of thought and engineering know-how going into protecting that data. Consent as a service, that's important to me, that's important to patients of healthcare throughout the world to have control of their own data. But I'm curious still about, from a patient's point of view, what's in it for me? So I've got an Apple Watch and at some point that data goes into Apple's cloud. Maybe I type in my email address and password and that goes into somebody else's cloud. But what outcomes, what's in it for me as a patient of this whole health cloud thing?
Sure. You then have to go down to patients because we're all citizens, but we're not necessarily all at any point in time patients. So if I just separate patients out, healthy patients, they may want to use some of the latest knowledge that's being developed in our medical science community to evaluate their fitness regime or their exercise regime or their eating regime. But people with chronic conditions do need to be able to interact with their physicians. So if I was diagnosed with a chronic condition, say for example COPD, chronic obstructive pulmonary disease, that is a lifetime condition. I will need to be able to report to my share my experience with my physician on how I am feeling, and that will help influence the treatment that I will receive, the pathway that I will be on. At the moment, a lot of the data, a lot of the patient-reported data is not captured into our healthcare system, and therefore we can't feed back to the patient the best research. Increasingly, what the patient will benefit from, improvements in healthcare, will come through better analysis of the data. So sharing that improvement with the patient is really the patient benefit.
The improvements that we've seen throughout the world in many industries with having live real-time metrics and analytics,
sure,
applied to my own health, and the idea that if there is a live point of view somewhere, that an expert can take a view on it and make more rapid, effective changes, sure, interventions, that my healthcare outcomes are considerably better.
Exactly. Imagine, for example, if you were an epilepsy. About 1% of our population suffer with epilepsy. So if you're an epileptic and you have a seizure, and you're out on a night out and you have a seizure, there is no data about you. What does the ambulance service, when they turn up, what do they know about you? What do they know about what medication you're on? What do they know about the seriousness of the effect? So what you will typically do is you will be transported into A&E. So you will have to spend time in A&E. A&E will have to do assessments. So you may potentially end up actually having to be admitted into hospital. A lot of that we can save and manage better for the patient. So if an ambulance attends an incident, they have no knowledge about you. You may be an epileptic. You may also have a comorbidity. You may be suffering with something else,
or allergies to
allergies that you would have. So another example, for instance, by properly tracking the medications our patients are on, we can look at indications of medicines and so on. So we can care for people better if they are connected. And all the evidence is that once I put you in charge and you have ownership of your health data, not only do you make sure your health data is correct, but you also are more likely to act and to change your behaviour if you can see the measurement. So I think behaviour change is one of the big areas. You know, we've shown the fitness watches how it makes people exercise, get their 6,000 steps. So there are tools for helping people and transforming people. There's some really good apps. There's a really good app looking at helping young mothers with concerns about child health. You know, there are areas like that where, as a new parent of a young child, the child gets ill. Children get ill very quickly, don't they? You know, to be able to have better access to information. So they're the kind of things that will transform the patient experience.
And it's not just patient applications, is it? I mean, we've made both patient applications and medical staff applications. And although currently some of the requirements seem to be quite standalone, I think increasingly they are plumbing through. It's
that interoperability and health cloud. You know, where does this data come together in the rest of our world? It comes together in the cloud, and health cloud where we will bring together our patient-generated data, our clinical data, and our genetic data. That's the real sweet spot. That's what will transform the way we look after our people as we get.
So what happens next? What's the next big sort of situation to overcome, milestone?
The big developments certainly that we're working on are in a couple of areas. First of all, interoperability. The average person would think that all of their health data is all seamlessly linked up. Your GP data and your data in your hospital and the data maybe in your care home is all seamlessly linked. The bad news is it isn't. It needs something like a health cloud to be able to link that. So there's a big initiative on at the moment. We're working with the NHS to build regional and national interoperability. So that's one of the big drivers at the moment, using data to save lives at scale.
So big organisations, big challenges in behaviour, both organisationally and just human behaviour.
It is.
but global, sort of world-changing stuff. You know, health outcomes on the mass scale. So much to be gained.
Absolutely.
Interesting times. Dennis, thank you.
Thanks, Phil.